I'm Congresswoman Chellie Pingree, and I'm very pleased today to have James Myall from the Maine Center for Economic Policy, which is an organization that does such great work in Maine, and we really depend on you for important information and for advocacy in these tough fights that we're in. And I just wanted to talk to you for a few minutes about the big, beautiful bill, very much misnamed piece of legislation that's already passed through the House of Representatives and now is at play in the Senate. And can we talk a little bit about these tax cuts, sort of your perspective on how this is going to impact Maine people and who's really going to benefit from this legislation if it goes through the Senate?
Yeah, sure. And thanks for having me on to talk to you, Representative. Yeah, I think the big takeaway from the bill is it's a giant tax cut for the rich that's mostly paid for by attacking the most vulnerable Mainers. And so it relies on cutting a lot of things that people rely on, whether that's Maine Care or SNAP, and other programs, and uses those cuts to deliver a giant tax cut to millionaires and billionaires. So it's kind of hard to think of a more upside down piece of legislation that you could pass.
Yeah, I mean, from what we've heard, it's about $3.5 trillion in tax cuts. Some are a continuation, some are additional. Generally, the take on it is if you're at the top, you're going to benefit greatly. If you're at the bottom, mostly because of the other cuts like Medicaid and SNAP benefits and just the multiple changes that could take place, you will do worse. So those who most need the benefit won't get it, and those who don't will just do better. Is that kind of how you think it will impact Maine?
Yeah, I mean, so folks at the top, sort of in the top 1%, are going to get tens of thousands of dollars in additional tax cuts. And then folks who are struggling, the people who most need the help, are going to see, like you said, are going to be worse off by the bill. There are some tiny tax cuts that are included for folks in the middle class and in the working class. But for low-income folks, those are completely canceled out by losing access to food assistance or healthcare when they need it. And I think, yeah, the other thing to bear in mind is even if you're not in those groups that are going to be directly attacked by this bill because you're not currently receiving Maine Care or SNAP or any of those programs, it's going to have these ripple effects in our economy and really hurt healthcare providers, even grocery stores that lose out on the SNAP benefits that are being spent there. So it's going to hurt all of us one way or another.
Yeah, I think a lot of people don't think about that. They say, oh, well, I don't receive Medicaid, so I should be okay. But I mean, one of the things we hear about a lot is just the impact on rural hospitals or hospitals in general, because if they lose the payments they're normally getting from people who are covered by Medicaid, that's just a huge deficit loss. And we just saw the closure of Inland Hospital in Waterville. So we
Mm.
know this is already happening. What's your perspective on that?
Yeah, I mean, like you said, we're like in Maine, we're unfortunately getting used to seeing, hospitals struggling and hospitals in rural areas either closing, like you said, in Waterville, or, cutting back on essential services. A lot of folks will see, maternity units closing, things like that. People, just having to drive further to get, in some cases, fairly basic services. And yeah, because of rural areas in Maine and elsewhere have large numbers of folks who rely on the Medicaid program to be able to meet their healthcare needs. That means those hospitals have more folks using that program. And if people aren't able to get their Medicaid, which is called Maine Care in Maine, if they're not able to get their Maine Care benefits, that means they still have those healthcare needs. They're often still ending up at the hospital, sometimes in the emergency room instead of in primary care, and hospitals have to treat them. So those end up as being extra costs for the hospitals that aren't reimbursed at all. So we've seen in Maine that since we expanded Medicaid here, it's actually helped hospitals' finances because they've gotten more payments for those things that used to be just be covered by free care. And we're risking kind of rolling back that progress and really endangering some of these places.
Yeah, I think a lot of people also don't understand the role that Medicaid plays in long-term care. You want to describe that to people? I mean, I've heard as many as half the people who enter long-term care live off of their savings for a while, but then eventually get out of
Mm.
Medicaid. I don't know. Do you know more about how that works?
Medicaid plays a really critical role in like a number of different life stages. And like you said, like in long-term care, a large number of folks in there are relying on Medicaid to make those payments. So if you look at nursing homes and other places like that in Maine, they really are dependent on kind of these Medicaid payments to be able to keep themselves going. So it can make a huge difference when changes are made to that program. We already know in Maine that we're seeing a lot of places, a lot of nursing homes already struggling to stay open and kind of really operating on thin margins. And so, there's definitely a risk for those places as well.
Yeah, one other thing is, I think one thing people don't understand is that the majority of people who receive Medicaid are already working, and particularly in a
Mhm.
state like Maine, where you might work three different jobs. You might have two jobs, one you go to in the morning, one you go to at night, or maybe you're a house painter, you work on a fishing boat, you pick up other odd jobs, you do a variety of things. And one of the challenges under the proposal that they're making is they say, oh, we just want to make sure everybody's working who receives
Mhm.
Medicaid. So this would just enhance the reporting requirements. And I've heard these like horror stories about states that have already implemented this. Arkansas maybe is one that
Mhm.
people had to report um, every month. The website didn't work at night, just all the obstacles that people put in the way. And I think sometimes that's hard to understand. Maybe you can explain a little bit better about the,
Mhm.
difficulties of this whole notion of reporting.
Yeah, I mean, yeah, it's easy to kind of say like we want to make sure folks who are able to work are working, and we want people to make sure folks are not kind of just using the program when they don't need to be. But I think, like you said, the reality is that actually what we see with these so-called work requirements is that actually they catch a lot of people out for administrative problems, folks who often are working but maybe aren't working regularly. So there are a few different groups kind of who get caught up in this who shouldn't be. There are some folks who just are totally meeting the requirements and there's some kind of administrative problem. Maybe they don't fill out the paperwork on time or maybe they make an error in it. And that ends up to them losing their care. And then, to get it back is really difficult for them. I think we've all probably had examples of, trying to deal with paperwork errors and trying to get appointments at places and having that be really difficult. But then, like you said, there's also folks, and I think this is a real issue in Maine, where we know a lot of people in Maine have experience of working two or three jobs. Maybe some of those jobs are seasonal. Maybe you're only working kind of shifts, and you don't get to control how often you get called in to work at the hotel or the restaurant. And that means, maybe one week you're working the 20 hours a week that the requirement needs you to. And maybe the next week you're not. And so when those hours are really variable, it can mean that you can get, kicked off the program, even though you're doing everything you can to try and make sure you work enough. And then there's a group of folks who aren't able to meet the requirement because they have something else going on. So I think, we're particularly worried about folks who might have kids or who have other adults in their life that they need to care for. Plenty of people in Maine have older relatives that they might be helping to care for. And those kind of things might limit the amount of time that you're able to work. Or, maybe most ironically of all, maybe you have a health condition that makes it hard for you to work. And
Right.
so, a lot of these folks, a lot of the rhetoric talks about these folks being able-bodied adults. But that able-bodied kind of term, which is used in the regulations for Medicaid, is kind of it can be hard to prove that you have kind of something that makes it harder for you to work, some kind of disability. There's a small group of folks who are, qualified for disability benefits who are the easiest ones to prove that, but there are plenty of folks beyond that who have, maybe they have some sort of chronic pain, maybe they have a mental health condition, plenty of stuff that makes it harder for them to work, or they can only work part-time, and they aren't necessarily exempted from this program. So, there's a the biggest problem with these is that they're really reporting requirements, and that reporting doesn't always capture kind of the reality of people's lives.
Yeah. And it's funny because almost everybody would say the one thing they hate about anything in life is paperwork or filling out forms, dealing with
Right.
computer systems, and this is just piling on people who have the least amount of time, might not have the best of computer systems or phones to work with to fill in the data. And it's just a way to make life miserable. Clearly, it's a way to save money in the program. I mean, at least that's the way I look at it.
Hmm.
It's a way to cut down on the
And
number of people who can do it, and you're cutting out the people who need it the most.
right, well, and it's also at the same time that we're seeing the folks in Elon Musk's team trying to close call centers and make it actually harder to get hold of a person on the phone. So it's sort of hitting people at both ends. Yeah.
Absolutely, and they're likely to continue that. Any of the things that we haven't really talked about the tax impacts of this? Again, it does seem
Mhm.
like there are some benefits thrown out there for middle class or working families, but do you think they will be beneficial or have as big of an impact as people may hope?
Yeah, I mean, I think that's the biggest problem, I think, in the tax impacts of the bill is that there are plenty of things in there that give, as I said, kind of tens of thousands of dollars to high income folks, um, and allow them to make kind of extra deductions around, increasing the amount of deductions folks with large houses can make for their property taxes, for example. But like the pieces that are put in there for low income folks are both very minor, and many of them expire as well. So kind of a lot of folks in the middle class, I think some of the figures show that their average tax cut that they'll receive is around sort of $150 a year. For some folks, that's kind of a continuation of what they're already receiving now. So that's something else to bear in mind is, this is also getting at the expiration of the 2017 tax cut. So for some folks, it's really just helping them stay where they are. Um, and then some of the other pieces that are in there, there are a couple of examples I think that are kind of important to bear in mind. The president talked about a couple of things on the campaign trail that they've tried to put in here around sort of tax exemptions for tips, for example, and tax exemptions for Social Security. A couple of things to bear in mind for those are that are pretty similar is, if you're a person on a low income already, if you're not earning a lot because you're a restaurant server who's only working part-time, you're likely not paying a lot of taxes on your tips to begin with. So that no tax on tips isn't actually giving you a very big benefit. Whereas kind of expanding the amount of deduction someone can take for their property taxes on their $1 million home, that's actually something that's benefiting someone a lot there. So some of these are just really small. And then you've got the fact that things like no tax on tips, gives this small extra benefit to somebody who's working at a sit-down restaurant, but the person working next door at the gas station or at the fast food restaurant isn't getting any tax benefit. So there's some very niche gimmicks that are in here. The extra deduction that they're giving for older folks to kind of mimic this idea of no tax on Social Security. Again, about half of older Mainers already don't pay taxes on their Social Security income because they earn too little. So some of this benefit, this extra deduction for older folks is actually going to folks who have large private sector pensions,
Mhm.
or they have investments that they're getting money on, and it's not actually helping the folks who need it the most. So, and we know some examples of some of those things that really do help folks. We saw those in some of the things like the American Rescue Plan Act, when we increased the child tax credit there and made it fully refundable for folks, that helped lift a lot of kids out of poverty. This bill has a smaller increase to the child tax credit, but it doesn't make it refundable and fully, which means that the folks who need it most, the people who have really low incomes, the kids whose parents aren't able to work, or kids of single parents, things like that, like they're not getting the full benefit from this bill. So it's just really a symptom of how even the things in here that are good are many of them are kind of gimmicky. They're not helping a lot of the folks who need it the most. And then some of them are even expiring after a few years and are not made permanent in the same way that the big tax cuts are.
Yeah, I think that's something people don't understand. You hear those things and you're like, "Oh no, no, there's benefits in there for all of us." Or they say in their talking points, the Republicans are saying like, "Oh no, this is great for the middle class and everyone's going to benefit from it." But as you've explained so well, really, it's the ones at the top who are going to make the most. Their tax cuts are permanent. These other ones are temporary, and really don't help as many people as we've all said. So I think, sum it up in any way you want. The way I look at it is we are cutting really vital services, things like Medicaid, SNAP benefits, a variety of things will be cut only to help the wealthiest people in this country. Oh, one other thing, a point I wanted to make, and you would know a lot about this because you do so much with state policy, but it's been my observation, for instance, when we were doing the debate around the SNAP benefit
Mm.
question in the markup in the Agriculture Committee, One of the plans of the Republicans is just to shift the costs back to your state. So anywhere between 5 and 25%, they're saying will be made up by your state. Well, if you do that with SNAP and Medicaid, and I'm on, other committees where you're seeing like they're shifting funding from the EPA costs and everything they can back to the states. Our states are already sinking under the weight of trying to pay for the costs. And if you add all the healthcare and all these other costs onto it, I mean, can you picture how Maine is going to survive through this this much cost shifting from the federal government back to the states?
Yeah, I'm really glad you brought that up because it's a huge issue potentially for Maine. I mean, it might be one thing if you're a wealthy state like California or New York, but Maine is one of those states that gets more from the federal government than we pay in taxes because the federal tax system is designed so that larger, wealthier states help to support smaller states with fewer resources. And this is sort of undoing a lot of that sort of fundamental bargain that we have in the United States. So yeah, we think it's going to push potentially, you know more than $100 million a year, maybe as much as $180 million a year onto the state budget. And that's a huge amount for Maine, and it means kind of state lawmakers having to being put in these impossible positions of either cutting these essential benefits that folks rely on, or raising taxes for folks at the state level. And in a way that is generally ends up being less fair than raising federal income taxes, rather than asking, the millionaires and billionaires in California and New York to pay for things. We're asking folks in Maine to have to pick up the tab for these benefits. So like you said, there are some things where there are just kind of direct cost shares. Maine is in one of the groups of states that currently would be hit hardest by the SNAP transfer, and would have to pick up 25% of the tab for that. And then there's also some things that are just, downright punitive. Maine is one of the states that has currently decided that we will pay for some children who don't qualify for federal Medicaid, to be able to get kind of these basic healthcare services. And so that includes some folks who are recent arrivals to the US, some folks who have legal status but haven't been here for long enough to qualify for Medicaid, and some folks whose status is still to be determined. We're paying for that out of state dollars right now, and that's the decision our state lawmakers made. But even though we're paying for that ourselves, the bill would propose to punish us for that and make us pay effectively a penalty of like $90 million a year for that. So there are just these, it's instead of using the federal government to kind of help states and to help some of the less resourced, smaller states, it's turning the federal government into a cudgel against these states. So it could have some really huge problems for the state budget.
Yeah, it's got huge financial implications, as you said, and it's just downright mean. It's just
Right.
mean, and taking the burden off the people who are most able to help out and putting it on the people who just have nowhere to turn to pay for these bills. So, well, thank you so much for spending this time with me today. I think we've learned a lot, and these are huge issues that we're facing in Congress. And we just are doing our best to keep this bill from ever seeing the light of day and ever passing. But yeah, as you can see, the Republican Party is intent on moving it forward. And we just all have to be fighting back. And everybody has to understand what's in it and why it will be so bad for
Mm.
our state and for everywhere in the country. So thanks again for all the great work you do. It's really been great talking to you.
Thank you, and thanks for helping to shed light on all this.